Welcome back to the Sussex, Ontario Election Show. I'm Joe Ragusa, head of our Ontario Government Relations Group here. It's been our pleasure to bring you these episodes every week where we talk about all things Ontario politics, government, and of course the ongoing election, which is due to culminate with voting day coming up on June the 7th. So during these episodes, we've been talking to you, different people from political parties and pollsters and media. And we thought today we'd spend the first half of our show talking a little bit about healthcare. Healthcare is an important part of our business. We have a number of healthcare clients that watch us. And I'm joined today by Abid Malik, our Senior Associate for Healthcare here. Abid.
Thank you.
Thanks for taking the time. So unlike maybe some previous elections, healthcare really hasn't been a wedge issue, a divisive issue in this election campaign so far. Certainly the Liberals have taken some hits for hallway medicine and wait times, but really, we haven't seen one party sort of take healthcare and run with it. You agree?
I fully agree. Generally speaking, healthcare doesn't really pop up as a major issue unless there's significant dissatisfaction with the healthcare system, and it's clear that people want to go in a different direction. In this case, all three parties have put forward very similar platforms as it relates to healthcare, and as a result, it's very hard to differentiate between the three parties.
It is, and I've seen on polling data that when people are asked what's on your mind, healthcare shows up near the top of the list, along with jobs and the economy and other issues. But so far, at least as we we're heading near the end of May for June 7th election, we haven't seen really one party gain advantage on the healthcare file, nor have we seen any of the parties really lose momentum or support because of healthcare. So let's talk a little bit about what each of the parties has on offer. And of course, at the time that we're sitting down talking about it, we haven't seen a Liberal platform yet. We're told that there is one coming, but we did have a budget that was tabled at the end of March, right, and passed at the beginning of May, just before the legislature dissolved for the election period. So why don't we start by talking a little bit about what was in that budget and what the Liberals have on offer for the people of Ontario as they think about who to vote for. So we've certainly seen lots about pharmacare and dental care and mental health. And why don't you just take a minute and share with our viewers what was in that budget and in the Liberal plan?
Yeah, I mean, I think the first aspect of the plan was really to deal with the issue around hallway medicine. I think the Liberals anticipated over the past few months, especially with respect to the questioning from the NDP and the legislature, that hallway medicine and this question of it was going to be a top of mind issue, and it's also very visible. It's the kind of thing where when people think of their healthcare system, they look around they look at the experience that they had in the emergency room in terms of if they see people in hallways, they notice that there's if they're getting care in hallways, they feel that there might be something off. So the Liberals decided to invest $822 million in our hospital system, which is a bit of a change in direction.
That's operating funding.
Operating funding, but it also includes increased procedures as well to reduce wait times. And it is a different direction in many ways, because for the past many years, the hospital budgets have essentially been flatlined. And that has caused some strains within hospitals. So the equivalent of 4.6% increase for hospitals was a big part of their plan. They also announced pharmacare for seniors. So they introduced OHIP Plus for those who are 25 years of age and under, no copay and no deductibles for a list of drugs, of about 4,400 drugs on the formulary. And they decided to extend that to seniors who currently pay the copay. So it was another part of their plan. The other piece was a historic investment, I guess you could say, in mental health. The idea of expanding Medicare to also include more mental health care services, which all parties agree is generally lacking. The Liberals went further than most by committing about $2.1 billion over 4 years, whereas the other parties have committed a similar amount, but over a longer period of time. That's the main crux. Also, very similar amongst all the parties is investments in long-term care and home care, things that, generally speaking, everyone would agree with.
Thousands more long-term care beds. Of course, we were around in 1995 when the Harris government announced 20,000 new beds, so taking the province's inventory from about 55,000 beds to about 75,000 beds. Those took a number of years to build out,
Yep.
and now we're finding that there is certainly a demand for more beds. And so it's really not a surprise that all three parties are talking about adding thousands of long-term care beds. I think with the fundamental difference is how many and over what period of time.
Right. How quickly can you build them?
Right.
And I think that, generally speaking, when one thinks about hallway medicine, the conversation has really come to the fact that there are people who in hospitals who are occupying beds who can be served in other places, such as long-term care homes, but there's not enough long-term care home capacity at the moment. So it's viewed, generally speaking, and it generally seems to be accepted, that expanding capacity in long-term care homes is one way of dealing with hallway medicine, and that's one of the reasons why all three parties have committed to it. Whereas the NDP and PCs have actually decided are promising to accelerate that.
Okay, and of course the Liberals they have spent a lot of money on infrastructure. There's some references in there to more billions of dollars for hospital infrastructure, and certainly Humber River Regional has a brand new hospital. There's a new one under construction in Vaughan. I think there's a new one in Oakville. There's new hospitals around, and they've indicated that they would continue that, I think.
Right, over 10 years, $19 billion is the figure that they used, which the NDP generally echoed. It's again about expanding capacity within hospitals, modernizing hospitals, making them more efficient, and allowing hospitals to operate much more effectively with more beds as well.
Right.
In order to deal with hallway medicine.
So I guess the thinking is that there are ALC patients, alternative level of care patients, that are bed blockers that could be not in a hospital but don't have somewhere else to go. That causes the beds to be occupied, which means that people that come in through the emergency room and need to be hospitalized don't have access to beds. They end up in a hallway.
Right.
So there's a bit of a bottleneck there, the thinking being if we expand home care, if we expand long-term care, that those ALC patients have somewhere a more appropriate setting to go,
Right.
freeing up inpatient hospital beds. Early in the campaign, the Premier, Kathleen Wynne, talked about hiring 3,500 nurses. I don't know that that was in the budget, or is that something that they came out with during the election?
It's something that came out, I believe, during the election. It wasn't directly mentioned in the budget. Generally speaking, nurses and nurses associations, they come out with their asks for the campaign. In the case of Ontario Nurses Association, Registered Nurses Association of Ontario, they're asking for a commitment for a certain amount of nurses to be funded. So the NDP put out a figure, the Liberals are putting out a figure, and these are not. This is part of the solution to hallway medicine. Opening new beds requires additional nurses. Opening new long-term care beds requires some degree of nursing support as well. So all of that gets calculated, and you end up with a figure that translates to a certain amount of nurses.
Okay, and last point on the Liberal plan, because all three parties now, certainly this is the first election that I can recall where all three parties are talking about government-funded dental care. So for our viewers, there are programs in place, say for children from low-income families, it's called the Healthy Smiles program, where dentists in their offices largely provide dental care for children from low-income families, and the government pays for it. That's a program that's been around for a while, but now all three parties are talking about more involvement in the provision of dental care.
Right.
So what did the Liberals say about that? And then we'll switch over to the PCs.
So the Liberals decided that for those who don't currently, for anyone who pays out of pocket for dental services and for drugs, so this covers the folks between the ages of 25 and 65 for drugs, but for anybody who has out-of-pocket coverage, they have out-of-pocket expenses for dental care.
So if you don't have a benefits plan, let's say.
Yeah, or even potentially, and that's why the details aren't murky, if the co-payment associated with it, potentially they might cover as well, if that gets to a certain point. So $700 for a family of four, it would be covered per year. Some would argue that that's enough to cover for certain dental procedures such as cleanings. Others, such as the NDP, and might say that that's not enough. Right. So they've got a different approach. But the approach that the Liberals are taking are essentially reimbursing costs that you've expended up to a certain maximum.
Okay, so switching gears to the PC party platform. So I remember when the People's Guarantee came out in November, there was reference to a dental program for low-income seniors in that document. And as we've seen as the elections unfolded, the new PC leader, Doug Ford, has in fact adopted certain planks from that platform, not all of it. It was 90 pages, and he's run sort of a much more concise platform. By the way, the PCs are saying that they will release a fully costed platform before the election's over. So far, their leader has been kind of putting out a plank a day, announcement of the day. But he's talking about adopting this program of his party's that would see low-income seniors having their dental care fully covered?
Yeah, in fact, I found that interesting because when he was on this show, he actually mentioned that of the things that he kind of agreed with in the People's Guarantee, one of them was extending dental care to low-income seniors.
All right.
And so he did, in fact, move forward with that, and he came out with an announcement last week about this. So the idea ultimately is that if you are of a certain income, that you can somehow, and the details are coming, receive some reimbursement for coverage for your dental expenses.
So I think that the numbers they've put out is they anticipate 100,000 seniors being covered, and the program would cost, once it's operationalized, about $98 million a year. So on the drug plan, and we do a lot of work for the Pharmacists Association here, a low-income senior for drug plan purposes is a single person that earns about $19,000 a year, and for a couple it's about $36,000. Certainly not big money. So what a senior who earns, a single senior is at $18,000 a year could look forward to is that his or her dental work would be fully covered by the government. Is that what we're looking at?
It depends. I mean, the details are not fully there yet. I mean, so there's different delivery models. Can they go to any dental office in their community and then get reimbursed for that? It's, with potentially some prior approvals, like the Healthy Smiles program. That's one way of doing it. They've also mentioned that you can go the government would be investing in community health centers and public health units as well to provide dental services directly out of there. So seniors potentially could go to those locations. So there's different ways of going about it, and it's one of the key things I've noticed amongst all the parties is that with respect to dental, some of the details are not fully baked yet.
Yeah, I think that's new to government largely, and so details to come, as is often the case in election time. But what are the PC saying about long-term care?
With respect to long-term care, they're looking at maintaining the same promise that the Liberals and the NDP had with respect to building 30,000 beds, except they want to accelerate that. So instead of 30,000 beds over 10 years, they would continue that, but instead of 5,000 beds over 4 years, over 5 years, which is the Liberal commitment, they would build 10,000 beds over 5 years.
Is it 10 or 15?
Oh, sorry, 15. My apologies.
15,000
over
5 years. That's pretty ambitious.
Very ambitious. There's an approvals process, there's a licensing process, an inspection process, hiring up. So a lot goes into development of a new long-term care home. In fact, there's also the aspect of space. In the GTA, or specifically in the city of Toronto, there may not be the real estate sites that are to build, but maybe outside of the GTA, there would be more of that capacity. So it's tough, it's ambitious, but he's clearly viewed that as a big priority.
Now, the Conservatives, are they silent on pharmacare? What are they? I haven't seen or recall hearing much from them in terms of the OHIP Plus program for the birth to 24 and this over 65s. Have they articulated a position on pharmacare? I don't recall one.
Yeah, one of the things we need to look out for, especially with the cost of platform, is to determine whether or not they're going to keep the Liberal plan as it relates to OHIP Plus for those over the age of 65 because that's slated right now and budgeted to take effect August 1st, 2019. So that's something to look out for. So far, publicly, they've committed to, in a variety of different comments, to keep OHIP Plus as it stands for those under the age of 25. This is something that Christine Elliott has mentioned as well in various public settings as well. So I think that we can expect, at the very least, that OHIP Plus will remain under all three parties. But the question about extending that to those seniors is not 100% clear with the Tories. And then those between the ages of 25 and 65, recall that the Liberals decided to move forward with some sort of a reimbursable up to $700 for your drug expenses and dental. Nothing from the Tories on pharmacare for that group.
Of course, in the background, the federal government, under the leadership of Eric Hoskins, who's been hired to be the national pharmacare guru, might make all of these discussions moot. I mean, if the federal government goes forward with a complete all drugs for everybody kind of program, then really there's not a lot of decisions for the provinces to make, is there?
Right. I mean, I think what Kathleen Wynne was doing at the very beginning, similar to what she did with respect to the retirement issue and the pension issue, expanding CPP so it provides greater pensions, to be able to set the tone with OA Plus in terms of what a national pharmacare program could look like. But right now, I think that they're in the middle of their consultations. Eric Hoskins is in the middle of their consultations, and by the time they come back and come back with their final recommendations, you're right, it could be all moot.
So the last thing before we switch over to NDP is Doug Ford and the PCs are talking about ending hallway medicine, giving hospitals the resources that they need in order to provide more and better care, more timely care, and get rid of this backlog. So beyond the long-term care beds, I haven't seen a number put to that yet, and I have seen Ford talk about he's going to consult with frontline experts. He says, I'll talk to the doctors, I'll talk to the nurses, I'll talk to the hospital administrators, and they'll tell me how to do it.
Right.
Bit of a risk, right?
I think that people are going to be expecting a number. The NDP put forward a figure of a 5.3% increase in base budgets for hospitals. The Liberals have put forward 4.6%. In fact, the NDP went above and beyond that and is committing to hundreds of millions of dollars for additional beds. 300, I believe they said 300 beds that they would be putting forward. So so they've put forward their details, and I think a lot of people are going to be asking Doug Ford, what resources are you going to commit?
Yeah, and maybe we'll see that in their platform document, but right. It's certainly, I think, when we ask people in the field, how do we go about solving this problem, it's usually expressed in a dollar figure. That's right. So that's going to be a bit of a challenge. All right, switching gears to the NDP. So in keeping with the theme, the NDP is talking about hospital funding, mental health funding, pharmacare, dental care, long-term care. So essentially it's very similar to what was in the budget.
Right.
And I've said on this show earlier, the NDP's game plan seems to be, if you're sick of the Liberals, but you like this stuff, you can vote for us and get the same stuff, but not have the Liberals.
Right. I mean, there's some variation with respect to mental health spending. It's a little bit slower under the NDP platform and it's a little bit more aggressive under the Liberals. The NDP is far more aggressive on dental care than the Liberals are. So there's a little bit of variation there, but in general, very similar platforms.
All right, so the NDP, I think, though, is talking more broadly about dental care.
Right.
Whereas the PCs are focused in on low-income seniors, and the government, the Liberal government, had a kind of limited, almost like a benefits plan. Mm-hmm. What's the NDP talking about? I talk about broad-based coverage, right?
Absolutely, and it is a different way of going about it. The NDP wants to put forward a new Ontario benefit, whereby employers and employees would cost share for those who don't currently have private insurance, would contribute towards a benefits plan that would defray the cost of dental care for that population. Those with lower incomes would not have to pay the copay, would not have to pay the premiums, but those with higher incomes would have to pay it. So it's an interesting way of going about it. It's going farther than any other party, and it remains to be seen how this is going to be rolled out. Right now, they've costed it at $575 million, above and beyond the premiums that they would receive. So we'll have to see how it works out.
All right. What else have they got on offer? What's kind of the highlights of the NDP health platform?
Going further on dental as well, they also will extend the Healthy Smiles program, or various public programs that currently exist for those who are under the age of 18, to those over the age of 65, to seniors. So very similar to the Tory, to the PC platform in that regard as well. So they intend to put forward more resources than the PC party.
All right, and have they put out a number on long-term care?
On long-term care, 30,000 beds.
So that seems to be the magic number for all the parties.
Right, but again, they intend to move forward far more aggressively than the Liberals. I believe they said 15,000 beds by 2023. So it's about within 5 years, 15,000 beds. So very similar to the Doug Ford campaign platform.
Yeah, the parties haven't really created a lot of daylight between themselves or among themselves in terms of who will do what on health care. I'm not sure that, quite frankly, the parties have been as creative or have looked as widely or broadly as they might have.
Yeah.
Certainly we have seen other professions that are beyond physicians. And we should say too, that's kind of what hangs over all of this stuff is that the Ontario Medical Association and the Government of Ontario are going to arbitration. Right. And the government has been reluctant to adjust funding models for other professions because that could be used as a precedent in the arbitration process. So, if you are another profession and you were in line maybe for a 4% increase, you've had to wait because the government didn't want to give you a 4% increase because then the OMA would go to arbitration and say, look, they gave them 4, they should get us 4 as well. So it's been kind of a hang up there in a lot of the funding decisions. But having said that, we do work for the pharmacists, and we were proud to work extensively on the flu shot in pharmacy program. And that came about because the pharmacists made a rational case for why it should be allowed. We didn't have to convince the Ministry of Health on the benefit of immunization. That's done. And the government runs a flu program every year anyways. But we said, why not extend it? The legislation allows for it. There's a regulatory college that developed a regulations package. Modest funding was agreed to. And last year, 1.2 million people got their flu shot in pharmacies. It's safe, it's convenient, it's accessible. You can do it on a Sunday afternoon if you happen to be in the pharmacy for whatever reason. And they're looking at us and saying, well, we could do more. We're qualified, we're trained, let us do more. Certainly we have done some work with audiologists on the question of testing and screening for hearing loss, particularly among seniors. Good idea, yeah. Regulated by a college. We have dentists who are looking and saying, well, we want to be an active participant in these discussions. So my message, our message to the political parties, I guess, would be it's great that you put this stuff out there and say we'll do this and we'll do that. Probably be a good idea to consult in a meaningful way with the actual providers, the people that are out there on the front lines and would be having to do this.
Absolutely. If none of the other parties, the NDP or the PCs, aren't putting out a figure in terms of how much they would give a raise to anybody. But what they did, their criticism of the Liberals is that they haven't managed the stakeholders as well as they could have, and the relationship with the doctors is one that sticks out and one that gets constantly brought up by Doug Ford and by Andrea Horwath. And so meaningful consultation is absolutely critical. Right now, Doug Ford is being criticized for the lack of a costing platform, and where is he going to find the savings, especially within the healthcare system? But at the same time, there are significant opportunities for savings within the healthcare system. If you take a look at things a little bit more holistically, I think that this was also brought up with respect during the debate between Christine Elliott and the healthcare debate on TV Ontario between Christine Elliott, Deb Matthews, and Franz Jelena. That investment in things like chronic disease, prevention, other healthcare professionals, these are things that can reduce downstream costs and also reduce the pressure on hospitals and reduce and potentially deal with the issue of hallway medicine.
Yeah, I think we're going to come to a fork in the road pretty soon. The Ontario budget now is $150 billion a year. 61 billion of that is on healthcare, providing healthcare for 14 million people. We talk about sustainability, which in our view is the affordability over the medium to long term. We talk about how sustainable is our healthcare system. I think whoever wins this election will have to, out of necessity, sit down and look for other ways and other efficiencies and maybe spreading things out a little bit so that we don't have people lined up. I think the polling indicates that, generally speaking, people in this province are pleased with the quality of the healthcare system. They just really hate waiting for it.
Yeah.
So it shouldn't take 7 months to get your hip replaced from the time you're diagnosed. I think everybody agrees with that. Question is, what are the ways that the government and providers together can come up with to alleviate some of those pressures? And if we maybe distribute the work a little bit outside of hospitals and physicians' offices to other professionals, that would help, I think, to alleviate a lot of that pressure, and in a way that's, quite frankly, cheaper, safe, accessible, convenient, and people will get the health care that they need so that those, maybe your mom can get her hip replaced in less than 7 months. You know, maybe we can get it down to 3 months. But I think it behooves the parties to have meaningful consultations. And I'm not talking about, we've all seen it. Look, we're in the government relations business here. Meaningful consultation is not, you know, we'll give you a meeting, we'll take notes in one of those black hardcover books and thank you for coming in and send you on your way. Yes, you met with them, but no, that's not meaningful consultation, I say with respect. So whoever wins this election is going to have a healthcare challenge, and they should know that the providers out there are really, all the ones I've talked to are willing participants. Everybody wants a better system. Nobody wants to be the one to give up their money to do it, but you need not necessarily do that. Like there are ways that they can work together. So rather than looking at these provider groups as stakeholders to be managed, let's look at them as partners to be meaningfully consulted with and collaborated with in order to deliver a better system. I don't think I'm dreaming in Technicolor when I say that.
I mean, this is all hands on deck. I mean, I think everybody wants to see the system be sustainable, and people do want to deal with the aging population that's currently putting a strain on the system. The first of the baby boomers turned 65 in 2011. So right now that 65-year-old is 72 years old. And so I think that's something that all parties are going to have to deal with.
Yeah.
And the more they consult and the more they consult with folks on the front lines, the better it is.
Last thing I'll say before we wrap up is the government of Ontario and the Ministry of Health in particular needs to do a much better job at adopting new technologies. These new health technologies are coming out weekly. The challenge is some of them are expensive, but the Ministry of Health needs to be able to look at a new technology as something that will help the patient instead of what we did in 1972. But they tend to look at it as in addition to what we've been doing since 1972. They need to change their way of thinking at the ministry, and for anybody watching at the Ministry of Health, sorry if that offends you, but we live this stuff every day, and you really need to get your thinking into this century. Anyways,
Absolutely.
Abid, we're out of time. Thanks for this.
No problem.
We're going to take a short break. We'll be right back to talk about other stuff going on in the Ontario election that's not healthcare. Stay with us.
For 20 years, Sussex Strategy Group has helped companies and organizations navigate government and bring about successful policy change. Our team of experts understand that it takes more than meetings and phone calls to turn heads and change opinion. It takes insight, strategy, and deep domain knowledge to get things done. In a world that's constantly changing, one thing stays the same. Sussex Strategy Group helps you win. Visit sussex-strategy.com right now and let us help you today. Sussex Strategy Group, 20 years of getting you results.
Looking to take your digital advocacy to the next level? Get in touch with our team at Sussex Adrenaline. Sussex Adrenaline is Canada's most awarded digital public affairs agency. Using our proprietary advocacy platform, Vox, supporters of our clients' campaigns have sent over 1 million letters to their local politicians advocating for change. Let us help you design your next advocacy campaign and get the results you need to win. Sussex Adrenaline, digital that actually gets you results.
Welcome back to the Sussex Ontario Election Show. We had a good discussion about healthcare with Abid Malik, joined now by Brian Zeiler-Kligman, Senior Associate in the Ontario Group here. Brian, thanks for coming in.
Thanks for having me.
So I guess kind of the big news of the week, there are polls coming out. Looks like the NDP really has all the momentum right now. The Liberals are tanking. The PCs have come off a little bit from their pre-writ and early election highs, but on Wednesday night, there was an advisory put out that the Liberals were going to release something on tape with respect to Doug Ford and one of his candidates. It came out Thursday morning. Just maybe take a minute to tell us what was in that.
Sure. So what came out this morning, released by Dev Matthews from the Liberal headquarters, and I'm sure anyone who's watching this show is well aware of what's just taking place, but that the suggestion is there are audio recordings of Doug Ford purchasing PC party memberships to assist a candidate who ended up becoming the candidate in Etobicoke Centre, and added to that as well is an accusation apparently supported by an affidavit from one of the rival candidates that she had actually been intimidated by Doug Ford. And I guess the key part to this as well is that this would be pre-Doug Ford as leader of the PC party. So,
All right.
Yeah.
So we'll keep an eye and see how that unfolds and plays itself out.
Largely an inside baseball
Yeah.
thing, it seems to be. So, yeah, we'll see.
Okay, so we wanted to spend a few minutes, just as we talked about the healthcare offerings of the three parties now. Most of our clients and the people who watch this, their organizations are in business, they're providers, they're vendors, they are people that are our clients, valued clients, and are curious to know if each of these three parties gets elected, what does it mean for my organization? What does it mean for us? Mm-hmm. So again, at the time that we're doing this, we don't have a Liberal platform released. We don't have a costed PC formal platform document. We do have an NDP platform. Mm-hmm. It was pointed out by the Liberals that there was $700 million in their contingency planning that they counted one way, should have been counted the other way, and Andrea Horvath admitted there was a $1.4 billion mistake in their numbers. But beyond that, I'm going to ask you, for private sector companies that are out there right now, let's just take a second, and so the PCs are leading in the polls. Mm-hmm. We'll start with them. If Doug Ford and his party are elected on June the 7th, what do business people have to look forward to, and what should they be leery of?
Yeah, so certainly with the entire narrative of this campaign, particularly the line about care versus cuts, we have seen most of the platforms have been really focused on healthcare, mental health care, dental care, pharmacare, all of those care programs. The economy, other than being a talking point in sort of the cost of living or the cost of doing business here in Ontario, hasn't necessarily featured as prominently in the platforms. But that doesn't mean that they're absent from the platforms. And certainly on the PC side, they've kind of fallen into two large buckets, I would say, in terms of what the PCs are offering on that economic development sort of business environment part. One is reducing the cost of actually conducting business here in Ontario, and so there's a few different components to that. The PCs have announced that they would drop the corporate income tax rate by a full percentage point. Of course, this is just the Ontario portion of the corporate income tax rate, so the income tax rate will go from 11.5% to 10.5%. They've also announced that they will reduce the small business tax rate. So under the Liberals, it's currently 4.5, but going down to 3.5, and that it will go from 3.5 to 3.2% under a PC government. And then as well, we've also got a couple of not necessarily directly business pieces, but certainly of interest to those in the business sector. One, a pledge to reduce the price of gas by 10 cents a litre. Both by dropping the cap and trade program as well as by dropping the actual provincial tax program on it, and then also that there are some personal income tax, again, just the Ontario portion of these that are being reduced. Specifically, it's the second income tax bracket, so approximately $43,000 to approximately $86,000. They're reducing that by 20%, or at least the rate is being reduced by 20% within there.
Okay.
The second bucket is about the government funding programs, and that's really been, certainly I know with clients, that's been a big part. Clients looking for government funding, particularly if they're starting up, they're undertaking a big project, being interested in finding some of these economic development programs to help stimulate certain parts of the economy. And so this has been labeled as corporate welfare by the PC party for a long time, and so not surprisingly, they have come out and said, particularly the Jobs and Prosperity Fund, which is kind of the big ticket government funding program in place currently, that's going to be canceled under a PC government. There was a clarification that regional economic development funds, so like the Eastern Ontario Development Fund or the Southwestern Ontario Development Fund, those are going to stay in place.
The northern
The northern, certainly.
So basically the GTA gets it again.
Well, that's been in place for quite some time, so yes.
All right, so, and that is all sort of themed under a big sign at the border that we actually saw.
And that's a pledge. That is one of the pledges, that there is
Ontario
going
is
to be a
open
sign.
for business
Yes.
again. So kind of a weird time because all of the macro numbers, this is the, from my chair, what I'm seeing. All of the macro numbers are good. Unemployment is low, growth on the GDP is good, interest rates are low, corporate tax rates, up until President Trump significantly lowered the American ones, we were actually lower than the US and state corporate tax rates. So now we might have to do some adjusting there. So at a macro level, things are good. And then we've got, while all of that is kind of going on, we have Kathleen Wynne talking and justifying her minimum wage plan and her child care plan, using language like people are hurting. The economy maybe is good, but some people are feeling the pain and it's not being shared by everybody, which is kind of weird in my view because I can't remember the last time an incumbent prime minister or premier in good economic times is talking about the pain that people are feeling. So,
well, and you've seen that with some of the Liberal ads where they're trying to stress the fact that the economic numbers are good under kind of Kathleen Wynne. The ones that aren't featuring Kathleen Wynne in them.
Although we do have a new ad this week, we should point out that prominently features Kathleen Wynne. It's a bit of a risk, I think, given that her favorable numbers are quite low and well into the negatives, but that's a chance that they're taking. So it's kind of a strange time in terms of the discourse that's happening in this election because, just think back to recent federal and provincial elections when the economy is good. Whoever is in power is just hammering that message home. I know that the affordability question has been raised a lot in the polling. The cost of living is an issue, and so the parties come out with their child care plans and reducing hydro rates, which everybody's reducing hydro rates by between, I think, 25, another 12's 37 for the PCs.
And 30% for the NDP.
30 for the NDP, although they're getting rid of time of use pricing, which somebody that works here says, I plan my laundry around those rates, so I guess I'm going to have to redo my schedule if that ends. Nonetheless, it's kind of strange that that is the debate that's happening, but we'll keep going.
Well, it is and it isn't. So, we've seen, so right now, the economic indicators are all favorable. Really what, at least at the macro level, one of the concerns are really those prevailing headwinds between the U.S. tax cuts that we saw that have only just recently come into effect, and then also, of course, the uncertainty around NAFTA. And even just yesterday, we've seen that President Trump has initiated a new review of Canadian manufacturing.
Because we're spoiled.
Because we're spoiled. Yeah. We've been very bad. So there are these headwinds that are potentially reducing the investment coming into Ontario, perhaps reducing some of that economic activity. The other part is really we're seeing some similarities to the BC election that took place about a year and a half ago, where Christy Clark was the incumbent premier. And again, you had strong economic fundamentals, and this was a long-standing Liberal government in power in BC, although the Liberal Party in BC is a little bit different than the Liberal Party here. And again, it was sort of the sense that cost of living was going up, or that it wasn't being, the economic prosperity wasn't being felt by everyone. And so that message, as much as it was hammered by the Christy Clark Liberals about the excellent economic news, it just wasn't resonating with the average voter. And we saw the outcome where, now it's a BC NDP government in place. Minority government supported by the Green Party.
How many seats?
Oh, I have no idea.
2? So the BC election, I think, is informative here. Keep an eye on this because you had the NDP and the BC Liberals essentially tied, and the Green Party, which I think were on 2 seats,
Yeah, I think they
actually holds a balance of power in a minority. Certainly the numbers here indicate that the Liberals are not going to win very many seats. The PCs are leading, the NDP is catching them or have caught them. We could see a minority government in Ontario where the balance of power is held by a small Liberal caucus, so we'll have to keep an eye on that one. All right, tell us what's in store if the NDP wins. What can our friends in the business community expect?
Well, you've already spoken a few times about the NDP strategy. Almost seems to be if you like the policies of the Liberals, you can get them with us without getting Kathleen Wynne. And so, not surprisingly, we've got similar sized debt coming out, and we've got similar programs, although they're somewhat different, with pledges of pharmacare and dental care and so forth. But one of the ways that the NDP is trying to temper these big spending promises is by actually also introducing some tax increases, so that they help offset the expenditure by bringing in some more revenue. And so, whereas the PCs have indicated they will reduce the corporate income tax rate in Ontario from 11.5% to 10.5%, the NDP has indicated they're going to raise that rate from 11.5% to 13%, which is where it was a number of years ago.
All right.
So that's one. They are going to keep that small business corporate income tax rate at 3.5%. So the drop from 4.5% as a rate to 3.5% is staying in place. But as well, and this is one that's not mentioned, that doesn't get a lot of attention, but it actually is quite an irritant. I know the Toronto Region Board of Trade raised this as one of their key policy planks, is the business education tax. And it's a portion on the property tax on businesses, which usually disproportionately affects companies in, say, the urban centers. And the NDP has actually indicated that they will actually bring in a uniform business education tax, so that it will level out. There's going to be there is a program for a continuous reduction of this currently, which the Liberals have kind of stopped, and the NDP will continue it until you get to a level rate. So that actually will result in a tax cut under an NDP government for a lot of Ontario businesses.
Okay, and we should point out too, the PC party, Doug Ford has said that he will not proceed with the increase to the minimum wage to $15 an hour come January 1st, 2019. The Liberals will, the NDP will.
The NDP will also mandate 3 weeks vacation.
Okay. We should touch quickly on the fact that the PC party will allow the sale of beer in convenience stores. The NDP quickly came out and said they will not. The Liberals, kind of a weird call, the Liberal War Room, calling out the danger, the recklessness of doing that, and then of course the war rooms from the PC party produced pictures of Kathleen Wynne standing in supermarkets where Liberal sanctioned beer is being sold in supermarkets but not convenience stores. So it was a little bit odd there.
Well, and similarly, especially if you follow on social media, a lot of people coming from other provinces where this already takes place suggesting that the danger to the public may not materialize in the same way. So yes, that played out in a few ways.
I remember I'm quite old, as you know, in 1985, David Peterson, that election promised to put beer and wine in convenience stores, and 33 years later, it still hasn't happened. That government never went forward with it. I mean, you know the beer industry better than I do, having worked for their industry association. I'm not sure that they would be enamored with the thought of all those extra delivery points, but that's, for them and the government to figure out, I guess.
For sure. It's a lot of this always comes down to the issue of price versus choice. If you've got more sales points, theoretically there's more choice, although many of those sales points only stock a certain number of brands or SKUs, and so the choice is somewhat limited there. But oftentimes it weighs on the price side of things, and we'll see whether or not the public is actually satisfied if that policy is actually put into place by what they see at the till.
So we had Catherine Fife on here, the NDP member from Waterloo, and we talked about the Jobs and Prosperity Fund, and she said they would keep it.
They would, yes.
But they would put some additional strings in there for things like apprenticeships. So that program would continue, but we can expect to see some more social levers attached to getting the funding. Any comment?
Yeah, so within the platform for the NDP, and again, the economy is mentioned in the NDP platform, but it's not really as prominent as all of the care categories that we've got. But really within the NDP economy plank, there's a number of pledges to do things like develop a food and water strategy. There's a pledge to create an advisory panel on the innovation economy. So recognizing that there are economic levers that the government can and should do in order to create a proper business environment, but they don't necessarily have the answers just yet. But the one sort of concrete pledges with dollars attached to it is that expansion of the Jobs and Prosperity Fund. So definitely that fund will continue under an NDP government, but there would be additional streams within it, one of which would be to help fund mid-career education for individuals. Another would be to promote manufacturing research and development, and there's $57 million annually for creating opportunities in the trades, as well as doubling the Career Kickstart program to create 27,000 new co-op and internship placements. So a number of different programs, initiatives being kind of shoehorned into the Jobs and Prosperity Fund, so really taking a much more prominent space in an NDP economic platform.
We'll give them credit for being a little creative and thinking outside of the box. And last point, I guess if you're someone that's in the business of building affordable housing or repairing affordable housing, you're probably looking forward to the next term of government, whatever stripe it is.
Yeah, so on the development side, the NDP is certainly the most explicit in terms of what they're going to be doing out of all of the parties. Their platform indicates that they're going to build 65,000 new affordable housing units. They don't say how, but they just indicate that that's a number that they're going for. They also indicate that they're going to expand on inclusionary zoning, which was a bit of a controversial issue that came up, and these are measures that municipalities can use to kind of mandate affordable housing within developments that come forward. One of the things that certainly a number of our clients will be interested in is just the fact that the infrastructure dollars being pledged by the Liberals and the NDP are both very similar. The one key distinction is that the NDP has indicated they will not be using P3s for their infrastructure building.
Oh yes, the evil P3s. Okay, so the thinking there that the government can borrow money cheaper than the private sector can, so these P3s or AFP, alternative finance projects, should be no more. All right, so we're out of time. If you have particular questions about how this election, how each of these parties would affect your business or your organization, feel free to give Brian a call or email him. You can look Brian up on our website, sussex-strategy.com. As well, if you have healthcare questions, you can get a hold of Abid, who was on earlier. And as always, you can contact any of your Sussex team here, and they'll let you know what all of this means. So thanks for joining us again. We will see you next week. We're coming into the stretch run. Look for crazy things to happen on the campaign between now and June 7th. The unexpected, expect it. And we'll see you next week.